What if one of the biggest threats to your memory isn't dementia? What if it's something millions of people already have and many don't even feel? High blood pressure. Most people think high blood pressure is a heart problem, but what researchers have discovered is far more alarming. Long before a stroke, long before dementia, long before obvious symptoms, high blood pressure may already be damaging the tiny blood vessels that keep your brain alive. And the scary part, many people don't notice anything is wrong until the damage has been happening for years. By the end of this video, you will understand why blood pressure and memory are deeply connected, the hidden warning signs many people miss, and what you can do today to protect your brain. Why you should care. Your brain only makes up about 2% of your body weight, yet it consumes about 20% of your body's oxygen and energy. That means your brain depends on a constant supply of healthy blood flow every second of every day. Now, here is where it gets interesting. When blood pressure stays high for years, that powerful force begins pushing against delicate blood vessels throughout the body, including the smallest vessels inside your brain. Most people worry about heart attacks, but many don't realize the brain may be suffering damage long before the heart ever sends a warning. The body-brain connection. Think of blood vessels like highways. They deliver oxygen and nutrients to every cell, including billions of brain cells responsible for memory, focus, learning, and decision-making. When blood pressure remains elevated, those highways start wearing down. The vessel walls become thicker and less flexible. Blood flow becomes less efficient, and the brain starts receiving less of what it needs. But here is where the story becomes even more surprising. The damage doesn't all happen at once. It happens silently. Tiny injury after tiny injury, year after year. Many people feel completely normal while it is happening. What happened inside your brain? Researchers have found that chronic high blood pressure can damage the brain's small vessels. The vessels feed critical memory centers. One of the most important is a region called the hippocampus. The hippocampus helps create and store memories. It's one of the brain's most important feeling systems. When blood flow becomes impaired, the hippocampus may struggle to function at its best. The result? You may start forgetting names more often, misplacing everyday items, walking into rooms and forgetting why, having difficulty concentrating. Now, these symptoms do not automatically mean dementia, but they can be signs that the brain is not getting the support it needs, and that's why this matters. The hidden damage most people never see. Most people expect brain damage to feel dramatic, a stroke, a medical emergency, but what researchers discovered next was surprising. High blood pressure can cause tiny injuries known as silent brain damage. Silent because people often don't notice it happening. No pain, no warning, no obvious symptoms. Yet, over time, these tiny injuries can accumulate and the brain gradually become less efficient. This is one reason experts increasingly view blood pressure control as brain protection, not just heart protection. A surprising part about aging. Many people assume memory decline is simply a normal part of aging, but here is where it gets fascinating. Researchers have found that brain aging can be influenced by factors we can actually control. Blood pressure is one of the biggest. In other words, Part of what some people call getting older may actually be years of preventable damage to the brain blood supply. That changes the conversation completely, because it means protecting memory may start with protecting blood vessels. The warning sign people often ignore. The challenge is that high blood pressure often has no symptoms. That's why it's sometimes called a silent condition. However, some people notice clues such as increasing forgetfulness, brain fog, difficulty concentrating, mental fatigue, slower thinking, reduced attention span. These symptoms can have many causes, but they should never be ignored, especially when blood pressure is constantly elevated, because the brain may be trying to tell you something. What you can do today. The good news is that your brain responds remarkably well to healthy habits. Start by knowing your blood pressure. Many people are surprised by their numbers. Next, prioritize movement. Regular physical activities helps improve blood flow to the brain. Focus on quality sleep. During sleep, the brain performs important maintenance process that support memory. Eat more whole food, fruits, vegetables, nuts, fish, and other nutrient-rich foods. Help support healthy blood vessels. Manage stress. Chronic stress can contribute to elevated blood pressure and affect brain performance. And if you are being prescribed medication, work closely with your healthcare provider. Controlling blood pressure isn't just about adding years to life, it's about adding life to those years. The biggest danger of high blood pressure may not be what it does to your heart, it may be what it's quietly doing to your brain. The frightening part is that the damage can begin years before obvious symptoms appear. But the encouraging news is that your brain is constantly responding to the choices you make today. And here's the question most people never ask. If high blood pressure can slowly weaken memory, what other conditions may be silently affecting the brain without us realizing it? That's exactly what we will explore in future videos. If you are interested in protecting your brain, improving memory, and staying mentally sharp as you age, subscribe for more brain health tips, because the brain you have 10 years from now is being shaped by the choices you make today.